Is hormone replacement something that should be done, that should not be done? Like, what's the truth? What's the data show? And it's going to be exciting. So just thank you for being here. Please make sure to review the show. Drop me a review over there on Apple or on Spotify. Make sure you share this out because this content can change lives. And it's so critical, so crucial to understand what the heck is going on here, because this is a big change from what was happening. We've been giving hormone replacement back all the way dating to the 1940s, like over 80 years. We have safety and quality, and especially tons, millions and millions of cases of people, women, of course, that have significantly changed their life for the better. Being on hormone replacement still is considered the standard of care for the vasomotor symptoms, the hot flashes, the trouble sleeping, all the things that are happening. It is the standard of care to help prevent and mitigate these kind of symptoms of menopause. But we've been doing this since the 1940s, and there's a huge safety record. It became super available in about the 1950s and 60s. 1970s, there was a little bit of a drop in the use because there was some incidence of endometrial cancer based upon the types of hormones they were using and the incidence overall of endometrial cancer. That kind of changed course back in the 80s and 90s when it was found that when you added the estrogen plus progesterone, that sort of minimized this risk of endometrial cancer. So we were using it again in the 90s, which is when I was in my medical training. And then this landmark study, for sort of all the wrong reasons, came out in 2002, the so-called WHI, or Women's Health Initiative. They actually halted their study early because they said, wait a minute, we're seeing increased cases of blood clots and cancer. And so although this data now, when we look at it in retrospect, it wasn't quite what they had said. It was not showing statistically significant rates of increased cancer. In fact, for most things, it showed actually benefit in reduced cancer in most of the women in the study, especially those that were on estrogen only. They actually had decreased risks of cancer. They had decreased risks of heart disease. They had improvement in their bone mineral density, less fractures, etc. Like literally the overwhelming majority of this study showed actually improvement and benefit in these women. Yet, because there was one subset, the subset of women that got both estrogen and progesterone, were showing some slight increase in breast cancer, which actually, when looking back at the data, it was just a trend. It wasn't even statistically significant. And this is not the common population. In fact, the average age of these ladies in this study was 61-ish, 61 to 63 was kind of the average. Most of the women were over 60 years old, which means that they were not actually in sort of the sweet spot for the treatment of menopause. Because right now in the US, menopause on average is happening around age 50 to 51. And menopause means, as many of you know, it's basically when a lady goes through this time where she basically has not had her period for an entire year. So truly her menses has paused for a full year. And on average, this is happening in the US about age 50 to 51. And what precedes it is the so-called perimenopause, which usually lasts around 10 years, which is when the hormonal fluctuations start to shift. We start having symptoms such as trouble sleeping, some brain fog, the hot flashes, being cold all the time, hot all the time, having some, what nowadays we call brain fog, right? You're just not as clear in your thinking processes, your cognition. Actually, this has been looked at recently and is shown to be a metabolic change that's happening in the brain based upon decreasing levels of estrogen, how the brain actually metabolizes glucose. So it's crazy. There's now more sort of mechanistically an explanation for what's happening to our women when they're experiencing these things. And so for dudes out there, like, this is not quote unquote in their head. Well, it is in the head in the sense that it is actually happening physiologically, but they're not making this crap up. Like, if they're saying they're having trouble remembering things or brain fog, like legit, it could be that they're in this perimenopausal phase and their estrogen levels are going down. And so it is so critical to not only appreciate these symptoms, but actually acting upon these early and not waiting till late in the course. Like this study, the 2002 study that freaked everybody out, was literally not done on anyone that was perimenopausal. the age that people really needed these medications, the estrogen and progesterone. And hopefully nowadays when people are using these, they're using the bioidentical ones and not the synthetic ones, which in this study were used, which have a greater incidence, of course, of adverse effects when you use synthetic hormones, which, duh, the body knows, right? The body is smart. The body, of course, if asked, would prefer natural bioidentical hormones, which were actually not used in this study. But despite that, most of the measures and most of the outcomes and things they looked at actually showed improvement. So it is crazy to think that because of this misinterpretation of the data of this giant study, the WHI, the Women's Health Initiative back in 2002, the overall usage of hormones in women for perimenopause, menopause, etc., declined significantly. And now present day, the average or the majority of ladies that could be benefiting are not. And it's because I think the big impetus was all of the media surrounding this study in 2002, which was not even well interpreted. So it's crazy. It's crazy. And it's so sad. And I think now we got to get the word out that hormone replacement for those in perimenopause and menopause, which extends to about a 10-year period. So I would say until about age 60, there's almost no reason to not be on this bioidentical hormone replacement. Like, it's literally pretty hard. And I'll talk about at the end those couple of cases that maybe these women maybe should not be on hormone replacement. But for the most part, by and large, the benefit is extreme. It is palpable. It is significant. It can be life-changing for women to be on hormone replacement so that not only they mitigate the nuisance of the hot flashes, the brain fog, the trouble sleeping, all these things that are undesirable that happen with menopause and perimenopause, but actually there's significant benefit with respect to decrease in cardiovascular risk and mortality, decrease actually in breast cancer is what we're seeing in the literature and the studies. And actually, even looking back at this 2002 study, we're seeing that the majority of these women, especially the estrogen-only group, actually had beneficial effects. In fact, less incidence of breast cancer, despite the fact that these were started late. The average age in the study was 61 to 63 years old, which is actually not who typically we're recommending go on hormone replacement, right? We'd love to catch it earlier. Within 10 years of menopause is best. You can start it perimenopausally with the symptoms leading up to menopause, and then for 10 more years, so up into about age 60, there's really not any significant downside, except in a couple of populations like active cancer, active breast cancer, things like that, estrogen-sensitive breast cancer in an active phase. There's a couple of incidences there, whereas folks that are predisposed to clotting disorders, etc. But it's very, very rare, and most women could significantly benefit for not only symptom improvement during the perimenopause and menopause phase, but also for improvement in bone mineral density so they don't have fractures, osteoporosis, improvements in cardiovascular risk, also improvements in brain function. In fact, even potentially preventing or decreasing chances of dementia. It's crazy the amount of benefits. And sadly, when the media jumped on this study in 2002, they misinterpreted the results. They blew them out of proportion. And it was crazy how quickly the usage of hormone replacement plummeted. And that's kind of where I came in. I finished medical school in, I think, 2002. And so this was what I was hearing. It like I learned in medical school all the benefits and kind of made sense. And then just as I was leaving and getting out into the real world, it was like, look at this study, it came out, blah, blah, blah. And I was like, what the heck? That doesn't make sense. And yet the fear from the media was so profound that most doctors stopped prescribing hormone replacements. And it's just, I think, disastrous. And nowadays, borderline malpractice to not offer a woman these potentially life-saving as well as life-changing, absolutely life-changing, naturally occurring hormones, right? The estrogen and progesterone. And so what's really interesting, like I mentioned, this study of WHI was done on a group of women that typically we wouldn't be starting on hormone replacement after age 60 anyway, right? They've already been 10 years after menopause. So most likely they're not having symptoms of menopause anymore, which is why we typically start the medication. So it was kind of on a strange group of people overall. Fortunately, we had a second study come out in 2004 that was basically a giant review of available literature of randomized trials that were done. And what was cool is they showed that there was a significant reduction actually in all-cause mortality for women who were on hormone replacement. Significant reduction, right? And this was almost exactly opposite from how they were touting the results of the 2002 study. And so this unfortunately didn't catch a lot of fire, if you will. Not a lot of people saw this, looked at it. It was a 2004 meta-analysis. It was done in the Journal of General Internal Medicine. It was entitled Mortality Associated with Hormone Replacement in Younger and Older Women. And their conclusion was that hormone replacement therapy, I'm reading exactly from the paper, reduced total mortality in trials, specifically with the mean age of participants under the age of 60, and no change in mortality was seen in trials with mean age over the age of 60. So less than 60 years of age, which is typically the population that we'd be expecting to be on hormone replacement, actually had less or a reduction in total mortality. And those beyond that didn't even have any increased mortality. So this was crazy because this flew in the face of what they had told us in 2002, just 2 years earlier, yet somehow this study, very important one in 2004 in the Journal of General Internal Medicine, did not catch fire. Most of us, including me, had not heard about this at the time. And it's sad because we got literally 2 decades of misinformation, really that started in 2002 with the WHI that was misinterpreted. And so millions of women lost benefit, not only in symptom improvement and quality of life, but potentially benefits in decreased mortality, decreased heart disease, decreased dementia, especially if they would have started hormone replacement prior to the age of 60. So crazy, crazy, crazy. So here's the deal. Back in 2002, when this study came out, as I mentioned, those that were on just estrogen alone, and these were all patients averaging age 61, 62, 63. These were not the typical patients that we would consider, not the typical ladies that we would consider putting on hormone replacement because they were already 10 years outside of their menopause. Yet this is the group that they studied. It was convenient. They had over 20,000 of these women. And what they found was the only group that showed increased incidence of the breast cancer was both on the combined estrogen and progesterone. And these were both, of course, as I shared earlier, these are both synthetics. But on the treatment that just got the estrogen alone, they actually had a 20% lower risk of cancer, specifically of breast cancer. 20% lower risk. And you never heard this in 2002. Nobody ever mentioned this. They were talking about increased risk of breast cancer. And that was only in that group of both estrogen, progesterone, in the synthetic variations, which we don't often use anymore, thankfully, at least those informed physicians and providers that are aware of the significant benefits of bioidentical hormones. We're not using these conjugated estrogens and the synthetic progesterones that we used to use. And so most of this, as was purported back in 2002, is just categorically untrue, right? Like literally for 20 years, the lay press, the public in general has believed that estrogen causes breast cancer. And that is just simply not the case. It's simply not the case. It's literally categorically just false. It is not true. This study was just broadly misinterpreted, and it has taken more than 2 decades to clear this up. There's physicians, providers out there that still believe that prescribing estrogen and or progesterone for perimenopause, menopause, and in this time frame, especially within 10 years of menopause, so up to age 60, they believe that they can increase cancer risk. And there's actually basically no data to show that that's true, no good data to show that that's true. And so I hope that one thing you'll take away from this podcast is that I hope and I pray that we can get the word out that hormone replacement therapy, especially in women in the perimenopausal and menopausal phase up to age 60, is basically, without a shadow of a doubt, shown to not only be beneficial, but actually improve mortality, improve bone density, improve risk of cardiovascular disease and dementia if started in this window. And there is no significant increase in breast cancer, for example. There's just no good data to suggest that there is. And so 2002 WHI, just be darned, it's not, it just needs to die. That study and the hype and all the things that came about from it, the WHI and saying that estrogen causes breast cancer, just simply untrue, simply untrue. And in fact, not only is that untrue, but many women for decades have missed out on not only just feeling better, because clinically, in my practice, we've seen just tremendous improvement in just day-to-day living, just the quality of life when you're having these symptoms of brain fog and trouble sleeping, the hot flashes, the cold, the energy, that's low, fatigue, and all these things that are going on during the perimenopause and menopause timeframe. Being on the replacement, bioidentical hormone replacement, whether it be estrogen or estrogen plus progesterone, is literally life changing. And to withhold this from a woman not only is disastrous for their health, but literally it affects the whole family. Like, I'm just thinking about women who are at home that may still have kids at home, a husband or significant other at home, that's seeing them suffer. And then just in the context of, if they're not getting this essential treatment, how it affects their quality of life, the whole family qualities of life, it's disastrous, especially for them. First and foremost, like, my heart goes out to them. There is a better way. If your doctor, your provider is not on board with providing bioidentical hormones, and you're in this period between perimenopause and menopause and the 10 years after, so I would say anywhere in the window between 40 years of age and 60, and your provider is pushing back, saying, you don't need that, just tough it up, like, you might just consider getting a new provider, because I'm telling you, there is treatment available. It can significantly improve your quality of life and have solid impacts on things like bone mineral density. There's a great study on how this significantly has improved the bone mineral density and decreased fracture risk. I'm going to see if I can find that for you. It was, let me just pull this up. Effects of meta-analysis reduces the risk of fracture. Here we go. This was in Osteoporosis International 2022. It's entitled Menopausal Hormone Therapy Reduces the Risk of Fracture Regardless of Falls or Your Baseline Fracture Probability. And this is astounding, because not only did it have nearly 26,000 patients, but basically, like, hands down, nearly everybody benefited. And it didn't matter if they already were at risk for osteoporosis or not. It basically showed that they all benefited by and large. And so this was kind of cool. I'll just read the conclusion. In the combined trials compared to placebo, hormone replacement reduces fracture risk regardless of the FRAX probability assessment and regardless of falls in postmenopausal women. So really, there's no reason why you couldn't benefit from, and this specifically was looking at estrogen replacement, but also some of the groups got estrogen plus progesterone. But the effects was so prominent, so astounding, that there's literally no debate that you get benefit from having estrogen in your bone mineral density, and less likelihood of getting osteoporosis and fractures. And so if you can get on this earlier is better. It can prevent the bone loss, right? Decrease your probability of getting fractures. And the converse is also true. They had other studies which basically showed that as soon as you stop the hormone replacement, the protection that the estrogen was providing, the benefit went away. And so there is a case potentially for not only starting early when you get perimenopausal symptoms, the estrogen will negate that, but it also will give you the bone mineral density benefits. And if you continue that at a low dose, even after the age of 60, you can retain that benefit and have stronger bones than you would have otherwise if you stopped the replacement, or if you just were never on it altogether. So super important stuff. And what's cool is there's a physiological reason, right? Like, estrogen is essential. It's a steroid hormone. It literally goes straight to the nucleus and starts affecting transcription. It basically is able to stop what's called bone resorption, which is the activity of these cells called the osteoclasts, which sort of break down and eat up bone. It actually inhibits this bone resorption, and it's part of the signaling pathway as well that helps to make the bones even stronger, like with weight resistance exercises. The in vogue thing nowadays, of course, resistance training. Well, when you're with appropriate levels of estrogen, that process can work better, and you can put down new bone tissue. The osteoblast, for example, is the cell that helps you put down new bone tissue. Its activity can be enhanced so that you have stronger bones and form new bone when your estrogen levels are appropriate. And so when these levels drop, especially significantly during menopause, the rate at which the bone is growing, or these osteoblasts that are forming new bone, that drops significantly. And the rate at which the bone is being eaten away by this other cell called the osteoclast, that gets increased, right? Because remember, the estrogen actually kind of slows down that bone resorption. So it's a sort of a double whammy. You're producing less bone, you're eating up more bone. And so your incidence of osteopenia, osteoporosis becomes significantly higher if your estrogen drops. So this in and of itself is a huge reason to be on bioidentical hormone replacement, specifically the estrogen, which helps significantly with respect to bone health. All right, here's another thing. You probably heard that the initial WHI, the same study in 2002, was also concerned about potential higher rates of dementia. Now, actually, interestingly enough, this did not reach what they call statistical significance, especially for the folks, the ladies here that only got estrogen alone, right? In fact, when we relook at this data, what's very interesting is that those that were in this specific study, the WHI, many of them, up to 55% of them, had been on hormone replacement prior to this study. In other words, they had already had some experience with it. And those folks that were withheld hormone replacement, right, that would be the control group. And then the intervention group was those that got the hormone replacement during the study. What was interesting is those that had previously received hormone replacement actually did better, even though their levels, of course, during the study period dropped because they had been withheld, this treatment, hormone replacement, had been withheld from them. But what was interesting is when they looked at the risk of, specifically of dementia, it basically didn't exist to any significant degree with those who had prior hormone use. With the group that had no prior hormone use, and remember, the ages of these ladies were on average 63 years of age, so much later than we would be starting hormone replacement typically. And even in those with the parent increased risk of dementia, it didn't even achieve statistically significant numbers. And so if you take into consideration those who had been exposed to estrogen before because they're already on hormone replacement prior to the study, any apparent risk basically disappeared completely. In other words, what they call the hazard ratio was less than 1, the confidence interval, was intact. And so it's just interesting to look at this because the lens with which you interpret the data matters significantly. And you got to look at the whole picture. You got to look at the groups of ladies and what actually was going on in their life. And so really my take on this, especially for those who had been on hormone replacement, they actually had a significant protective effect. In other words, being on estrogen actually decreased their risk of dementia, and no significant difference in risk for those others, okay? And so it's another reinforcement to me that withholding hormone replacement from women can not only be disastrous for their bone mineral density, also their cardiovascular and overall risk of mortality, as I shared earlier, right? Those that were getting estrogen had a decrease in all-cause mortality, but also with respect to the dementia risk, if you're starting it, especially within that 10-year phase between 50 and 60, because the average onset of menopause is around 50 in the US, and you're starting at sometime in that window, I would say anytime between 40 and 60, there's basically no significant risk of dementia. In fact, there's improved, or I should say decreased, risk of dementia. And so very interesting, because what the data actually shows was very different from what we were told it showed back in 2002. So I wouldn't be worried about increased risk of dementia. In fact, if you're starting it with this within the window between 40 and 60 years of age, there's basically almost no risk. I mean, I can't say no risk, but literally the studies don't show any significant risk in that window. The only ones that did purportedly have increased risk, and this was just a trend, it wasn't statistically significant, was those who were started more than 10 years after menopause onset, so in the 60s. And so very interesting, I think, to look at this. And lastly, I want to share about cardiovascular disease, right? Because one of the big reasons that many people stopped using hormone replacement because of this WHI trial 2002 were I would say the two biggest purported reasons were both the potential increased incidence of breast cancer, which, as I shared earlier, was only in that group with estrogen plus progesterone, and these were ladies over the age of 60, so not the usual group to be started. And they were on the combined therapy with synthetic estrogen plus synthetic progesterone, and it was trending, but it was not even statistically significant with respect to increased breast cancer. And there was actually a decreased risk of breast cancer in the estrogen only group, as I shared, but that was never really popularized in the media. The other thing they purportedly showed, right, was that there was an increased risk of cardiovascular disease, right? That's one of the things that got a lot of physicians and providers scared was, oh my gosh, are we going to increase the risk of heart disease, which is the #1 killer in women and in men, of course, across all the US? And so when we look at that and look at the actual data, what we do see actually in the follow-up to this study was that in the 10-year follow-up, there was actually a 44% reduction in risk of major coronary disease when you were on estrogen. So you actually did have benefit as was not initially shown in the WHI data. So super interesting, but there is potential to reduce cardiovascular mortality. And there's certainly, when you review all the data, there's certainly no significant evidence to show that there is an increased risk, especially for those that are starting at any time between 40 and 60 years of age. And so don't not get started on this if you're fearing potential cardiovascular disease risk and you're in that window between the perimenopause and menopause, somewhere in between 40 and 60 years of age, because we don't really have data showing that you have increased risk. In fact, the secondary analysis looking at this data found that women who started on estrogen within this 10-year period, like I was sharing, between, typically between 50 and 60 or so, they actually had decreased risk of coronary disease. And that was relative to placebo. And so in women who have basically not started until that 10-year window, they still got improved risk scores. In other words, less likelihood of cardiovascular disease. But what I thought was even more interesting were those that were started on it earlier, those that had initiated hormone replacement, say in the perimenopause period, they had a significant decrease. In other words, that they got even more benefit if it was started sooner. And so what was interesting is that when it comes to hormone replacement, when you think about the overall risk of cardiovascular disease, there's actually additional protection when you have estrogen around. Estrogen is great for decreasing your risk. In fact, when women have menopause and that estrogen plummets, then that's when their cardiovascular disease risk goes up and starts to get more similar to men. In fact, during all those years, women have a much decreased risk of cardiovascular disease, even though it's still the #1 killer in women. Also, of course, the #1 killer in men, but that risk starts to increase once their estrogen drops and they start to reflect more of a pattern like males or men do, because we don't have the same levels of estrogen floating around, which is significantly protective. And so this sort of overall stigma, this panic that started back in 2002, and I was aware of this. I sadly didn't know the whole context. And, I wasn't in primary care, so prescribing hormone replacement wasn't something that I was typically doing, but I was seeing that the levels at which people were accessing this had dropped. And now looking back, like, this really makes me sad, because a lot of people have missed the sweet spot, between 40 and 60 years of age, and may not be getting the appropriate protection from heart disease, the protection from dementia, even protection from breast cancer, as shown, and the clear benefits for bone health. And so now I think first and foremost, what I would hope that most will get out of this podcast is that once and for all, we can literally declare this WHI study 2002, which people thought was showing increased risk of cancer, increased risk of heart disease, stroke, and all that, this needs to be declared false and dead in the water. And we got to move on because there's so much data showing the exact opposite, that you can significantly benefit from hormone replacement in women. And next week, I'm going to talk about in men, the men equivalent of menopause, which is andropause, right? The drop in the testosterone. I'll also talk a little bit about testosterone in women because they need it too. In fact, what many women, and actually most men also don't know, is that the levels of testosterone floating around in a woman's blood actually exceed the levels of estrogen, progesterone, and these sort of female hormones. And most people have no idea. So testosterone is very important in women and, of course, in men. And so we're going to talk about that more next week. But for now, don't hesitate to share the good news that hormone replacement therapy can be not only life-changing with respect to symptoms, but potentially even life-saving with respect to decreased cardiovascular risk, decrease bone mineral density issues, osteoporosis, osteopenia, and fractures, decreasing all that risk, and also decreasing the risk of dementia when it started within this window of perimenopause, menopause, and the 10 years thereafter. So roughly in the ages of 40 to 60 years old, which is actually a big part of who's listening to this today. My audience has most people in that sort of 35 to 65-year-old window, which is who I'm directly speaking with. And so if you're a woman out there, I hope this is helpful to you. If you're a man, please make sure your woman understands this and that you understand that these symptoms of hot flashes and brain fog and issues with energy and low libido and maybe having the sort of that general fogginess and not sleeping well, difficulty sleeping, that's usually the progesterone portion. This is not just in their head. This is physiologic, and it could be perimenopause, menopause, and that there are solutions, there are treatments available. They are simple. They are not complicated. The risk that many of us have thought was significant is not what we thought. It's in fact nearly the opposite of what we thought. And I just want to share with you a couple of sort of cases to bring this to light, sort of everyday use, and kind of bring this home, if you will. So let's take, for example, a lady that was having symptoms such as the brain fog, trouble sleeping, waking up at night, being hot or cold, like literally within weeks of what I would use was bioidentical hormone replacement, including both estrogen and progesterone, very, very low dose, that these symptoms can nearly completely dissipate within a couple of weeks. Like, it is life-changing stuff. And there's no reason why this should be feared, because the data just does not exist to show that we should be fearing this hormone replacement therapy in men or in women. We'll talk about the men. We'll talk about andropause next week. We'll talk about testosterone in women and men. I don't want to jump the gun on that and get too into that right now. But I would say, less is more. You always got to start slow and then titrate up. That's sort of how I prefer to do it. I've found that the transdermal estradiol works great. You can start super low dose, 25 to 50 mics a day, for example. The oral micronized bioidentical progesterone is great. I start slow, maybe about 100 milligrams at night. This is actually what's cool about this progesterone is it can help you sleep, because some of the reasons that these women are waking up in the middle of the night is because the progesterone is dropping. And there's actually benefits, and maybe we can talk about this next week, of progesterone in men. Guys, sort of health influencers out there, really smart people as well, physicians that I'm aware of, dudes that are actually using low-dose progesterone because there's benefit there as well. Maybe we'll talk about that next week. But there's really, just to bring this home, there's really no good reason to withhold this treatment for women in the perimenopause and menopausal phase, because the fact that estrogen was purported to cause breast cancer based upon this 2002 WHI initiative is false. Like, full stop, false, not true. And it's sad that for 20 years, many have suffered due to that. That's the very same study actually showed decrease in breast cancer in the estrogen treated group. So this notion that estrogen causes breast cancer, like if there's one thing you take away from this right now today, full stop, that is false. Estrogen does not cause breast cancer. In fact, it may even help prevent it. It certainly may help you feel a whole crap ton better. And it is safe by and large in nearly all groups. Like I mentioned, there's a couple areas that there might be, some contraindications, like somebody with active cancer happening, somebody with significant history of blood clotting, venous thromboembolism, pulmonary embolism, things like that. These are very rare scenarios. And so by and large, you should not be afraid, right? You should not be afraid of these bioidentical molecules that your own body makes so that you feel awesome, and don't let your provider withhold them from you based on an erroneously interpreted study in 2002 called the WHI, the Women's Health Initiative. Get the facts. And if you're having trouble finding someone that will work with you, go to the website ifm.org. That's a great place to find providers who are well trained in this. That's the Institute for Functional Medicine. That's where I got my functional medicine training. Guys like Mark Hyman, who many of you know, he's in that group, the Institute for Functional Medicine. Great group of people. They understand this. We understand this. And I'm there. I'm here to help. Feel free to message me. Follow me Instagram at Dr. Thomas Hemingway, Facebook Thomas Hemingway MD. You can reach out to me there. You can go to my website, thomashemingway.com. If you want to work with me, there's ways to do that. I offer a full look under the hood. Like right now, present day, it's, I think, laughable. You go to your provider, especially if you're a woman in this age group between 40 and 60, and you say, hey, I want to get my hormones checked, and they roll their eyes at you. I mean, both guy and gal providers are literally rolling their eyes at patients, women who want to know their hormones, unless maybe they say, I'm trying to get pregnant. And they're like, okay, for sure, well, let's go do it. You have a right to access this data. If you're having trouble getting that, reach out to me. I can help you find somebody, or we can potentially work together. I want you to know what's happening with your body. I want you to have a look under the hood, because you just can't guess this stuff. And the good news is that hormone replacement therapy, by and large, men and women, significantly helpful. It may change your life, certainly will change the quality of your life, and could even help prevent things like breast cancer, heart disease, all the things that you've been warned about that could go wrong. Most of it is just total BS. So make sure you share this out, share this episode, reach out to me, and drop a review. And until next time, mahalo, which is thank you, and a big aloha.